Hi there, my name is Taylor and I'm going to be your student practical nurse for the day. Could you just state your name and your date of birth for me?
Kirstin McWaid, July 13th, 94.
Okay, perfect, Kirstin. And you have your wristband on you there
Sure.
from the ER? Perfect, I'm just going to check that too. You don't have any allergies?
No.
Okay, awesome. So I hear that you've received a new diagnosis and that's what's kind of brought you in today. Doctors prescribed a couple new medications for you, so I'm just here to go over those with you if that's all right.
Yeah, that's fine, because I didn't really understand much of what the doctor said, because it was really quick.
Yeah, for sure. No, that definitely happens. That's why I'm here. So you've been diagnosed with what's called a DVT. So that just stands for deep vein thrombosis. It can happen for a variety of reasons, but it's essentially what happens when blood clots kind of formulate in the deep veins. This is a lot more common to happen in the calves or in the lower legs, and it can cause some things, like pain and swelling are the two biggest ones. Sometimes people will see, the redness or kind of streaking along their vein, and depending on the person, they describe it as either like a cramping or just a general soreness. And sometimes too, you can even see a bit of a change in skin color at the site. So like I said, it'll look like red or purple.
Mm-hmm.
If you touch it, it can be a little bit warm at sometimes. So those would be things that we'd be expecting with that. And I hear that you've been experiencing a lot of pain in that area, which is what brought you into the ER.
Yeah, so the pain starts at my calf
Mm-hmm.
and then works its way up to my thigh. And then I also noticed that my veins were kind of sticking out. So I didn't know if that was normal or not.
Yeah, so the pain and the discomfort that you're feeling, it's 100% due from just the pressure that blood clot's putting on your veins. So same with those protruding veins. When that blood clot kind of gets in there, if it starts to obtrude, it makes your veins just stick
Kinda
out
like
more than normal.
Swell.
Yes, exactly. You got it. So the doctor has put in some prescriptions to help manage with that. And the first one we're going to talk about is Dilaudid. So that's the pain medication he's put you on. Have you ever taken that before?
No, I haven't, but isn't that an addictive drug?
Sometimes people for sure can develop some addictive tendencies with it, yes. However, as long as you follow the prescription of doses and only take it when you're in pain and need it, that really decreases the likelihood of you developing, any type of addiction to that medication. Just to give you some more information on it as well, there isn't a generic name that goes with it. It's called hydromorphone. I don't know if you've ever heard tell of that before. It's the same thing.
I think I do recall that one because my dad was on it when he had his surgery last year.
Okay, yes, it is a pretty common pain medication. Typically with adults, if they're able to take pills, that's how we give it, usually in a dose of either 2, 4, or 8 milligrams. And this drug too, like I said, it's your pain medication, so it's technically classified the big fancy word opioid agonist. I don't know if you've heard of opioids before.
Mm-hmm.
Essentially all that means is it just works to completely rid your body of pain because it blocks off the receptors that help detect it. So that's all that means.
Okay. I had a question. Do all adults receive the 2 milligram dose like that I'm prescribed?
So it kind of depends. That's usually the dose that they'll start with, and then they can always add more from there if necessary. So for different reasons, like your age, weight, your liver functioning, and then a big one too is also if you've ever taken opioids or other pain medications like, morphine or anything like that in the past, perhaps you've developed a little bit of a tolerance to it. In those situations, we might give you more. But since this is, the first time that you've ever been prescribed an opioid and you don't have any other issues, the doctor is going to start you off with the 2 milligrams and then kind of go from there and see how it works.
Okay, so I'm starting with the 2 milligrams because I've never had it before.
Exactly.
Okay.
Yeah. So with this medication, the goal that we're trying to achieve is just to help manage the pain. And it's good for treating in between kind of moderate to severe pain. There's some things that, we kind of have to be aware of when you're taking this medication. So assessments that we do before and after. For example, Dilaudid can cause your blood pressure to go down. So we'd be checking your blood pressure before giving it to you, and then also about 30 minutes or so after, just to make sure that it hasn't dropped it too low. The same thing with your pulse, and then your respirations too, so your breathing rate. We're gonna check those things before and after just because it can kind of slow everything down, and if it's already kind of slow in the beginning, we might not give you the medication just because we don't want to kind of contribute to that.
Okay, so you're going to do blood pressure, pulse, and keep an eye on my respirations.
Yep, exactly. So Dilaudid's made to treat your pain. So a big thing too that we're going to be assessing is what kind of pain are you in? What's your pain level like? So we're going to ask you things like how severe it is, where it's located. So you explained to me earlier, it's kind of in your calf and then radiating up your leg. So we're going to keep reassessing those things, really just to see if the medication's making a difference in treating that for you.
Okay. That makes sense. So why do you need the when I'm in a certain amount of pain beforehand, you can use, like, after I take the Dilaudid, you can use that as a assessment afterwards to see if the pain has subsided?
Yeah, like think of it kind of like a scale. So if, we came in the room and asked you to rate your pain on a scale of 1 to 10, you said it was a 5 beforehand, and then when we come back in 30 minutes later and you're saying it's a 2, that basically just indicates to us, like, okay, that medication that she received, that was effective.
Okay, perfect.
Yeah. So it's important to know too that sometimes Dilaudid can have some sedative effects, which basically just means that it can make you feel sleepy or drowsy or confused, or even sometimes hard to wake up, which can sometimes impact your consciousness. So kind of make you fall asleep and then maybe have a really difficult time waking up, especially if someone's trying to wake you. And this is not what we want this medication to do.
Okay, so that it basically just means that it can do more harm than good. And I also wanted to ask, is there any side effects with this medication?
Yeah, so sometimes it feels like a bit overkill with these assessments that we do, but they're really important because they can indicate to us some of these side effects that you might be experiencing. So the things that I just mentioned, like the sleepiness, the confusion, being hard to wake up, those are all some fairly common side effects of Dilaudid, because they just kind of slow everything down and just make you very relaxed. And then another one that would be important for us to mention too is a lot of people on these medications experience constipation, just because it kind of slows down everything in your gut and your digestion. So it might be a good idea to have some stool softener suppositories at home, and just make sure that you're drinking lots of water, eating lots of fruits and veggies high in fiber. But those would be some key things to try to help combat that. And then some really serious adverse reactions that are rare but can sometimes happen would be if we saw like slow and shallow breathing, if you were feeling really lightheaded, or if you were extremely difficult to wake up. So be sure to tell your partner that you live with to look out for those serious ones, and if you are experiencing them, make sure that they call 911 and get some help right away. But the first few that I mentioned there, the confusion and that type of thing, those would be pretty standard, so just keep an eye on them.
I'll tell my partner to watch for those really bad ones. So the normal side effects, I don't expect to be too scary. And then, so that would be the dizziness, the constipation, and the confusion.
Mm-hmm.
And then I do have some stool softener at home, so I could use that.
Yep.
So that'll be perfect. And I'll be sure to tell my doctor if I'm experiencing any adverse side effects. And maybe that means that I'm having a reaction to the medication.
Yeah, exactly. So make sure if you are feeling those to let your doctor know. When you get home too, be sure to just take a look at the instructions that are on the bottle there, for when to take it, how often to take it, how much. The doctor's prescribed for you right now, I just have here in your chart, to take 1 tablet every 3 to 4 hours as needed, and you can take it with or without food. So this just means that if you're not in pain for 4 hours after you took your last one, you don't need to take another one. So it's just, you can't exceed 1 per in that 4-hour chunk, but that doesn't mean that you need to take it every 4 hours. And make sure too that when you're taking them that you have a drink of water or something with you to drink before and afterwards, because that just helps to get it down a little bit easier. Something else that's important too, that the doctor looked into to make sure that this medication is compatible with other meds that you're on, just so that we don't have any extra complications from that. So if you do get prescribed something new, make sure that you tell them if you're still taking this medication at that time, because it can interact with some other things. And then also it's important that you take these pills whole, so you don't want to crush them or chew them up, because it can kind of impact the way that your body absorbs it. So you can get just a lot of the medication all at once, or not very much, and then your pain isn't really resolved. So it's important that you just follow the instruction there in the bottle for how to take it. And then I know another important one that's written right on the bottle too is just to make sure that you don't drink alcohol while you're taking this medication, because they both kind of work to, you know, sedate and just kind of slow the brain down and everything, so then you can end up getting those kind of more adverse reactions we talked about.
Okay, so take the pill, 1 tablet every 3 to 4 hours, and then I'm gonna use water, which is fine because I drink lots of water anyways.
Good.
And I'm not a drinker, so I won't be mixing it with alcohol.
Perfect.
And I have no problem swallowing pills, so I won't crush them.
Awesome. Sounds good. It sounds like you know how to safely take this medication. So there was one other one that the doctor prescribed for you as well. Are you feeling okay to talk about that one now? It's the heparin that he prescribed.
Yeah, we can talk about it.
Okay, sounds good. So this is the medication that's going to kind of help get rid of that DVT in your leg, and it'll also help prevent the new ones there from forming. So you may have also heard other names like, you know, Hepaline or Heplock, which are just some brand names of it. This type of medication is referred to as an anticoagulant, but typically people refer to them just as blood thinners, so maybe you've heard of that before.
I have heard of blood thinners. I think one of my family members is on one, but how is that going to help my blood clot?
So basically the goal for an anticoagulant or a blood thinner like heparin is to prevent your blood from clotting inside your body and then leading to blood clots that get trapped in those deep veins. Like I said, kind of in your legs is where we commonly see them. Or if clots do occur, so in your situation where you already have one, it helps to prevent them from getting bigger. So this is what we would call the therapeutic kind of use of the medication. It's the goal that we want it to achieve. Because over time that DVT, it will dissolve on its own. There's a different medication that they can prescribe sometimes to help dissolve them. In this case, the doctor's quite confident over time it'll go away on its own. But we are prescribing the heparin there just because we don't want it to keep growing. Because then if it gets bigger and clots off the vein or relocates to your lung or your brain, you can have some more serious impacts there. And then that would be considered a pretty emergency situation. So does that kind of make sense?
Yeah, so you're saying that the heparin's going to help not make it any bigger. It's going to help dissolve it, and it's going to hopefully prevent any further clotting?
Exactly, yep. So the dose the doctor has prescribed to start you off, which is a pretty normal dose for an adult, is 5,000 units every 8 to 12 hours. So the nice thing about heparin is that the pharmacy actually has it already drawn up into these little pre-filled syringes so that you don't need to do any of the measurements or try to figure out what to give yourself. It's already pre-filled in that syringe.
Oh, I like that idea.
Yeah, it definitely makes it a lot easier. So at least then you can just go to your pharmacy and get it directly from them. Just like with the Dilaudid, there are kind of some certain assessments that we do keep an eye out for with it. And then some things too that at home you can be watching for. So a big one really is just looking for signs and symptoms of bleeding. So this could be, you know, bleeding from your gums when you're brushing or flossing your teeth, seeing blood in your stool, your urine, or having nosebleeds, or even unusual bruising too can be an indication of bleeding that's going on. And even sometimes doing your blood pressure can be important because that can help to indicate, you know, if there's bleeding going on internally that we just can't see from the outside. And then a big one, especially in your situation, would be looking for signs and symptoms of another DVT, so another one of those blood clots in your legs. You know, seeing if one of those pops up somewhere else, because the reason that they've prescribed this one for you is to hopefully, you know, allow it to go away. So we want to be able to tell if it's working or not. We're going to be watching to see if another one's going to show up or if it's going to help work as it should to prevent them. So in the hospital too, you know, we do blood work constantly, so we'd be checking certain levels in your, you know, your platelet count, just to see how your blood would be clotting. At home, usually they don't go ahead and do that quite as often, but the doctor might ask you to come in for some routine blood work, but those would just be things that we'd be watching for. And then since the doctor too ordered it to be given in that syringe, so you're gonna have to inject yourself with it. We just want you to make sure that you're watching that injection site. And, you know, just looking for redness or bruising or just some indications that maybe the medication isn't absorbing that great. So if it's starting to look a little bit gnarly, definitely make sure that you use a different spot and let your doctor know.
Okay, so just watch out for the large amount of bleeding. That would cause concern. And then the bruising. And actually, I have one of those blood pressure cuffs at home, so I can check that while I'm at home.
Yeah, most definitely. Yeah.
Perfect.
And we can even send you home too. We have some little pamphlets I know at the nurse's station there that kind of give the steps on like knowing your normal ranges for your vitals. So that way, at least if you are checking your blood pressure at home, that'll give you an indication if you're kind of falling where you should be for that. But those are definitely a lot of the key points for this one. As you said, watching that injection site and the signs of bleeding would be the key things. There are some side effects and adverse reactions to be mindful of, although they're pretty uncommon. Some people can develop a hypersensitivity to this drug. With this, you would feel, like chills, like you have a fever, and you may even have blood in your urine as well. Anemia can occur. So that's something that could be picked up for, routine blood work. Which is, with that, basically just not enough oxygen's kind of circulating through your red blood cells to get to your tissues. So that can make you feel dizzy or confused. So that would be one of the adverse reactions, is just kind of that hypersensitivity. And then the other one is this big long word. It's called heparin-induced thrombocytopenia. Like I said, it's a very big word.
Yes.
All it means, it's pretty straightforward. All it means pretty well is that the heparin is causing your body to not produce enough platelets. And platelets are just a component of your blood that help it to clot. Which, I mean, to an extent, we're given the anticoagulant because we want to produce blood clots, but that's going to affect your blood more and not your platelets. So if it starts impacting your platelets, that's how we can kind of indicate that it's an adverse reaction. So for your routine blood work, that's something that they would be monitoring too, just looking to see if that adverse reaction might be going on, because we don't want those levels kind of getting too low. Because if there was something going on like that, it's likely your doctor would get involved and either change you to a different medication or change the dose that you're taking.
Okay, so let me repeat this back to you so I know that I got it right.
Yes, for sure.
I need to watch for signs of bleeding, watch for chills, because it can mean that I'm sensitive to the medication.
Yep.
Actually, my sister had anemia once growing up, and I knew what symptoms to look for there, but I'll have to make sure to stay on top of my blood work and regular testing, and I'll mention anything out of the ordinary to my doctor as soon as I notice anything.
Yeah, for sure. So if you do notice anything that's off, that's perfectly right. Just make sure that you mention it to your doctor. This medication does need to be injected into the fatty tissue. That's how they give it out. So it's allotted. It's just a pill that you can take. This one you inject with a syringe, and it goes right into the fatty tissue. A lot of the time people use the abdomen or the thighs just because it's, especially when you're giving them at home, it's an easy accessible. There are some different places that if you're in hospital they might use, but usually for heparin they go right for the stomach.
Okay.
So I think that's probably going to be your easiest one for at home too. The key thing with injecting into the abdomen is just make sure that you're at least 2 inches away from your umbilicus or your belly button. So stay 2 inches away from that. You want to clean the area really well with an alcohol swab before doing the injection and allow that to dry. And then you're just going to kind of pinch using your thumb and your index finger. You're just going to pinch some tissue in between your fingers. And then you can remove the cap there from your syringe. You can insert that right into the fatty tissue, and then slowly you just want to press that plunger down. It's really important with heparin too, after you give that injection, you don't want to rub it or anything. Because with that, if you do any rubbing, you can end up with some really big bruises on your stomach. And some bruising with heparin can be normal. You might see some small areas, but they'll just be a lot bigger if you are applying any type of pressure or anything afterwards. And then you just want to make sure too that the insertion, when you're putting that needle in, you're using a 90-degree angle, so you're just going right straight in, and that you're rotating sites. So if you give it, let's say right here on your stomach in the morning, when you go to give it again at nighttime, maybe you'll give it over here. So you don't want to use that same site repeatedly, because that can just lead to kind of the tissue starting to break apart, and you see a lot more bruising with that, and it'll also get more painful too. If you're doing that long term, it can even impact the way that your body's absorbing that medication, so that's something to be mindful of as well. But I'm pretty sure, I think that just about covers the basics of that injection. It is important when you're doing needles at home that you'd have a safe way to dispose of them. So you can get what we call just sharps containers, or those units that you see hanging on the walls all over the hospital, the yellow ones. You can get just little handheld ones of those just from your local pharmacy, and then you can use that to dispose of these needles. But yeah, I'm pretty sure that pretty well covers how to give that injection, and I actually did bring one in here with me too if you'd like to just kind of play around with it a little bit.
Sure.
And just see.
Yeah, that'd be great.
Yeah, I just tucked it right in my pocket because I knew I was coming in to see ya. So this is pretty well what it would look like. So it's already filled with the medication there, and it has the plunger. So there is a cover on it right there now. So you're safe to touch it and everything. But yeah, so could you demonstrate to me kind of how you would hold that in your hand and then how you'd go about squeezing your stomach if you were going to do that?
So what I do is go a couple inches away from the belly button.
Yep.
Grab some fatty tissue.
Yep.
And then insert at a 90-degree angle.
Yeah, you got it.
And count a few seconds and then remove it. And then I want to rotate the sites so that I'm not bruising.
Exactly.
And I don't want to apply any pressure, because if I do, then it's going to give me an even bigger bruise.
Exactly, you got it. But yeah, I just thought that would be helpful just so you could kind of get the picture in your head of when you go to your pharmacy to pick up this medication, that's pretty well what it's going to look like. But it sounds like you have the key points to kind of go about safely giving that medication.
Do I just throw the whole thing in?
Into the sharps container?
Yeah.
Yep, once you're finished, you can throw that whole thing. So with some needles, you can get it where sometimes the needles and stuff will detach off, but I wouldn't even bother messing around with all that. You need to just throw the whole thing just right into the sharps container because you won't need to reuse any component of it.
Oh, perfect. I'll have to grab one of those from the pharmacy then.
Exactly, yeah. And like I said, if they do cost anything, it's not much, but I'm pretty sure, I know I've had patients in the past who were diabetic and use needles, and I'm quite certain usually their pharmacy is able to supply them with those containers. So, yeah.
Okay, well, I think that pretty much, I think I got it.
Yes.
It's pretty clear right now, but I may have some questions later.
For sure. So I actually have a pamphlet just out with your discharge paper sitting on the nurse's station there that just kind of outlines some key points that we've discussed today. And it also just gives you another bit of a rundown about your diagnosis and how to safely give yourself those medications, and what things to look out for if you are having some maybe adverse reactions, and what side effects might be normal, because we discussed with Dilaudid there are a couple of things that you can expect. But if you don't find that those answer your questions, be sure to reach out and ask your doctor. Since the plan is that you're going to be discharged from the ER later this afternoon, I understand that you might still be feeling a little bit kind of clear right now, but you might be fuzzy when you get home with the information.
Yeah.
So most definitely just maybe set up a follow-up with your family doctor to go over this new diagnosis and the medications, and they can definitely kind of reiterate and re-explain some of the information that I've laid out here for you today.
Perfect.
And then I'll make sure too, I know that you're due for your heparin injection here within the next half an hour or so. So I'll make sure when I bring that in that we allow you to kind of practice with that before you get home for the day so you can get comfortable with it.
Yeah, that sounds like a good idea.
Okay, perfect. So no more questions for me right now?
No, I don't have any, I don't think. When I'm doing the injection though, is there a certain method to it, or just one side to the other?
So it really just depends. I know oftentimes some people like to do kind of like a clockwise formation around. That way it kind of helps to keep it straight in your head a little bit easier, and that way you remember kind of where you last did your injection. But it's really just whatever works best for you, as long as you're not repeating those same spots.
Perfect. I think that's the only question I had.
Okay, perfect. Well, I'll be back in again shortly there with your meds for this morning. And then we'll keep working to get you discharged later this afternoon. But if you have any questions in the meantime there, just let us know.
Perfect. Thank you so much.
No problem. It was great to meet you, Kirstin.
You too.
All right.